Well, good morning, everyone, and welcome again to another live this morning. Hope you're having a great day. And as usual, I'll wait for a few people to come on and then make sure that everybody can hear me and see me. Here we go. Carrie, sorry. Good morning and to you guys. And Coralie and Arlene. Mike from Wawa, Andrea from Nouveau-Brunswick, and Nativity, good morning to you. And Jerry, Nouveau-Brunswick. Wendy, good morning to you, Wendy. Donna, hope you guys are having a great day. Sharon, Maria, and Yolande, bonjour. And Nick is on with us this morning, and Chantal. Good morning, my vitamin M. I am her vitamin M. Good. Glad to hear that. And Anna and Claire and Sherry and Jeanette is watching this morning. Steph, comment ça va, Steph? And good to have you on. Jeanette's son and Laura from New Liskeard, Mary. You guys are great. Thanks again for coming on. We got a lot of questions we want to hit. Evelyn and Roland, Joss, good to have you on. Did you miss me yesterday, guys? Denise, okay, and Margaret, good to have you. Lots of good questions. I really appreciate it, okay? So Merrill is asking, I always break these down into usually supplements or food, and then we talk about conditions, okay? So that's how I like to break these questions down. So the first tranche of questions, Merrill is asking about drinking ketones. Now, I've talked about this in the past, but I'll just repeat. There are a lot of new things out there, relatively new, and they're really classified under what we call exogenous ketones. Okay, so let me explain. If you don't eat carbohydrates, don't eat carbs for 3 days, your body will go into ketosis, okay? Now, big difference between ketosis and ketoacidosis. Doctors get that confused, and they shouldn't. And this is why they used to go after Dr. Atkins. The Atkins diet. He'd put you into ketosis. And doctors was thinking ketoacidosis. Those are people that generally in diabetics or whatever, their blood sugars are, or if you're going to die, and you're on your way to death, you're going to go into ketoacidosis. That's when your body literally starts eating away at your muscle. It's very toxic. But we're not talking about that. We're talking about ketosis. Your body burns ketones instead of burning carbohydrates. If you don't eat any carbs, your body switches fuels. And your body burns ketones. Then there's another class of ketones. They're called exogenous ketones, meaning that you can either drink it by drinking, you've heard of this, bulletproof coffee, right? You take a combination of palm oil, coconut oil, it's MCT oil. So it's not just like you're drinking a little bit of coconut oil or whatever. These are extracts. They're made, okay? The oil is a blend, and sometimes it's straight from coconut, or sometimes it's palm oil. And, you know, you put it in your coffee, and then you put some butter in there, and you get what we call your drinking ketones. Look, I tell people, look, I got no problem with it, but, you know, I wouldn't spend the money. For me, like, you know, I wouldn't spend the money on it. Like extra exogenous ketones, I'm not big on that. Like if you want to make yourself a bulletproof coffee, I got no problem with that. Some people, they find with that medium chain fatty acid oil that it bothers their stomach. If that's the case, then don't do it. But how much benefit are you really getting? I know it's burned differently, goes right to the liver and that, but I'm not huge on it. I'd rather you eat a low-carb diet, get the benefits of your body burning fat for fuel instead of burning carbohydrates. I like that much better. I like it better in food, okay? So, Janice is asking about drinking tea. Now, you see this behind me here? You know me. Tea does not get on the Martin Clinic vitamin list. Am I saying it's bad for you? No. But I like to tease people. I say, well, why are you drinking tea when you could drink coffee? Coffee's so much better for you. Now, there are herbal teas and green teas, and I got no problem with that, folks. I really don't. If you like tea, I feel sorry for you. Okay, I do. But I'm teasing, okay? Just understand some people take me too literally in a sense that I'm just sort of pulling your leg a little bit. You know, I feel sorry for people that like tea and not coffee. I do. But you don't want to put coffee up against tea in terms of the benefits. Tea gives you benefits. Coffee just gives you many, many more. That's just a fact, guys. Okay? Okay, Renee, or Bonnie was asking about 5-HTP. Okay, now 5-HTP, you can get it as a supplement. It can calm you and it's not bad for your adrenals and cortisol, but I like a combination much better. I'm big into combining things. Because over the years, I just find, if you just use like 5-HTP on its own, I just never found it to be that effective, if you're asking me the question. The reason that we have a blend in our cortisol formula is it's a blend. And over the years, I just find combining those makes it much more effective. Am I saying that 5-HTP is not good? No. I'm just saying I found something better in my personal practice years. I always tell people, look, I had to get results. I was in a clinic. Like a lot of companies, they got they just put products out. But they've never had experience in terms of having to get people who had real issues and getting them well. And not just me. That's why my son and I started putting out our own products in the clinic. Because I wanted certain formulations. And, Tony Jr. is a biochemist, so he's very good at putting things together, okay? Much smarter than his father. So, anyways, clinically we had to get results. That's where we come from, okay? But these are good things, nothing wrong with them. Renee is asking, does magnesium increase blood pressure? Just the opposite, Renee. Just the opposite. Magnesium is meant to relax whenever you think of magnesium, think of the word relax, okay? Relax. It relaxes your blood vessels. It relaxes your muscles. Okay, so no, it should be just the opposite with blood pressure. I guess, like anything else in the universe, some people are, I tell people, again, I'm teasing. I used to tell patients right in my office, you're weird. I was pretty, hopefully they could, I didn't wear a mask, so they could see my expressions. I was teasing them. Like, Doc, I find if I drink coffee, I don't feel good. Well, you're weird. Everybody, there's 7 point what now, 3 billion people on the planet, and everybody has their own fingerprint. And, sometimes, I eat that and I don't feel good. Well, I know, but you must understand, I'm speaking to the masses. We have over 65,000 people watching us on Facebook. Over a couple of million downloads on our podcast. Well, you know what? I got to speak in generalities. Sometimes on these Friday questions, you're asking me a question, I know, but you're weird. And I mean it in a loving way. You better learn to laugh at yourself, okay? I tell people that. Don't take yourself too seriously. Laugh at yourself. It'll bring your blood pressure down. I laugh at myself. I'm an old man. Okay? And, you got to have a sense of humor in life because, some people, they can't even drink water. It bothers their stomach. I said, I know, but you're weird. Okay, so just take it like that. That's what I'm saying on that, okay? But, Renee, no, okay? Now, reset questions. Couple of good questions on reset. Doc, why no sweeteners? Okay. I'm not being... remember what the reset is. The reset is a 30-day program. It's a temporary program to fix. A temporary program to fix about I think I'm up to 17 or 18 things that it changes in your body. I don't want any, if you can, look, no chemicals, no artificial anything. Can you use stevia? I guess so. If you have to absolutely have it in your coffee or something, even though stevia is a more natural, whatever, I'm just not, I would rather for 1 month of your life, don't have anything artificial. For a month. Now, when you go after the reset and you're eating low carb, so post reset, you know what? Then of course, then you can use, if you want to use a sweetener or whatever. For the 30 days though, I really want, because I want you to get rid of all your toxins. I want you to empty out your liver. I want you to clean up your kidneys. I want your body to have nothing distracted. How about that? For 30 days. And I just tell people, trust me on this. And Doug, I don't think I can do it. A lot of people, I know I didn't say it was easy. When you're used to a lot of things, but it's amazing. The results are incredible. And I always tell people, suck it up, Buttercup. This is a life-changing, metabolism changing, getting you off the Titanic changing 30-day eating program. And it works. What can I tell you? It works. Again, I'll go back to my clinical experience. Literally, I started with diabetics. That's how I started the reset. I wouldn't allow them any carbohydrates for a 30-day program, and they couldn't believe it. What happened to their blood sugars? What happened to their insulin? Incredible. You see, guys? And then I started giving it out to hormonal, anything in a metabolic storm, adrenal gland exhaustion. I gave it out for everything. I started, look, if you do a 30-day, because what it did is it took your blood pressure, it took your liver, it took your kidneys, it taken your heart, it's taking your blood vessels, it's fixing, it's changing your body. Look, here's a question. Let me just get to it. Oh yeah, Kristen was asking, I think somebody else was asking about plaque buildup in the body. Well, you know what? Plaque. You know, you could have blockages in your carotid artery. That's plaque. I'm a cause and effect guy. So I always go back to what caused that to plaque up. Okay? It's not cholesterol. There's inflammation that damages the Teflon layer of your blood vessels. That's what starts plaque. But inflammation's not Houdini. You have to go even a step beyond that. To insulin. It's food. Now, it can be leaky gut, because that can cause inflammation. And oxidative damage can damage your blood vessels. Free radical damage. But again, the ones you can control is food. If you lower your insulin, you fix your insulin, it's amazing what happens inside your body. It's amazing. Can you get rid of plaque? Yeah, I've seen it happen. I've seen it happen. Is it going to do it every time? No. But it's a big, big, big change, and it's your body. You got to give your body will do it. Your body is fearfully and wonderfully made. They've shown that even at the age of 80, your body's regenerative abilities are amazing. Now, they get less as you get older, of course. But that's why I always tell people, you're on the Titanic, get off of it. Or change course before you hit the iceberg. Some people have already hit the iceberg. They've already had a heart attack. They've already had a stroke. They've already got cancer. Well, then you do everything you can to put your body into a fighting position to get rid of those things. Now, will it 100% get rid of stuff? It depends. It depends. Okay? So, can a hiatus hernia be reversed? I can't even read my own writing. Who was asking that question? Dawn. Well, again, you can put it to bed. You can put it to bed. I found over the years, if people with a hiatus hernia, I would tell them, look, lower your carbs, do the reset. Carbohydrates really affect a hiatus hernia. Stop eating around 5 o'clock at night. Don't eat late. Give your body lots of hours before you go to bed to completely digest your food. Take digestive enzymes with every meal. Every meal, if you've got a hiatus hernia, take digestive enzymes. I find if you do those 3 things, it's amazing what happens. Does it get reversed? Well, you put it to bed. I always got good results. I used to get tremendous results if people would conform and do it. It's not, not eating at night is never easy, but it's like a habit. Eat early if you can, and stop eating and don't eat again. That's why even I like intermittent fasting. You stop early at night, and if you can go past breakfast, you don't necessarily have to. But if you can, the longer hours that your body's not eating, when you have a hiatus hernia or you have insulin or you have, some people can't go that long without eating. But most people, when they get their body used to it, they can do it. It's a habit. Habits are formed in 3 weeks and reinforced in 6 weeks. This is why I want people to do it, the reset, because I go past 21 days. They form habits. And they didn't realize how much of a carboholic they were. But whenever you get hiatus hernia, whenever you get acid reflux, whenever you get most digestive trouble, the worst thing is carbs for digestion problems. Okay? Really good question. Annette was asking, is there any connection between hearing loss and dementia? Yes, there is. Okay? Yes, there is. Now, what's the connection? See, it's not just hearing loss. Look, if you were working in a factory and you lost your hearing, when I was a kid, I lost about, 60, 70% of hearing in my right ear. I had an ear infection. I remember it like it was yesterday. I was probably in grade 6 or grade 7 or whatever, I think. And, I think it was about a month or two later, okay, and I had a real bad ear infection. A month or two later, I remember putting, you remember when you opened up a bottle of soda, like Pepsi or whatever, or ginger ale or whatever, and you could hear the psss. Well, I could hear it in my left ear, but I couldn't hear it in my right ear. Okay? I got hearing loss because of an infection. But I'm going to tell you something. You get hearing loss as you get older. One of the biggest problems in that, I'm a cause and effect guy. It's not the hearing loss that's is the connection to the dementia as much as it is the insulin. Insulin creates inflammation and infection. You could have a low-grade fungal infection. Remember, we talked about this in Alzheimer's and dementia. One of the things they're finding out is that they have leaky gut. If you have leaky gut, you can have yeast, a fungal infection. Ears, infection, or insulin. It's one of the signs. Even tinnitus, it's one of those. What? What's tinnitus got to do with insulin? Has everything to do with insulin. The vast majority of people that have tinnitus have high insulin levels. They have high circulating insulin. So that's why I mention this to you. I'm a cause and effect guy. When people, I think I said this 20 years ago about hearing loss. You're more susceptible to Alzheimer's, to dementia, yes. But why? And I go back, it's not the hearing loss. It's what could cause the hearing loss, okay? So that's the way. Good, very good question, by the way. Let's do a little bit of COVID, okay? I got questions about COVID. Boris Johnson, Lynn, Amy, Nativity, we're asking questions on COVID. So let me go over this. What about immunity? Like if you get it once, do you have it again? Look, what we know about COVID today, okay, what we know about that virus today, compared to what we knew even back in January or February, like we've learned some stuff. Here's what we've learned, and I just want to put it in in a short little capsule for you. Here's what we've learned, okay? And this is just general, and don't give me the exceptions, okay? I'm speaking in generalities. This virus, 99% of the population, just about, it doesn't affect them. It's affected us. It's affected 100% of the population because of the lockdowns and the second wave and the third wave and the vaccines and whatever. Okay? Of course, it's affected everybody's life. But in terms of this virus being dangerous, most people it isn't. But, young people, almost nobody. The vast majority of deaths have been with much older people, like in their late 70s, and especially when you get over 80 years old. And when it's over 60 years old, that's 60 to 80 age, COVID hits the people that have, number one, high blood pressure, obesity, okay, we talked about this, okay, high blood pressure, obesity, metabolic syndrome. I wrote my whole book on metabolic syndrome. So if you're in that 55, even higher, a little bit 60 years old to 80 years old, and you have high blood pressure, you're at risk. You're at risk from COVID making you very ill. If you don't have any pre-existing conditions and you're in that age of 60 to 85 even, you hardly have any risk at all. Those are just the facts, okay? Like, I know there's a lot of stuff. Somebody said to the Amish, how come you don't have COVID to the Amish? And the answer was, because we don't watch TV. You know, TV has really, really ramped up COVID. And I just one more point. Where did the flu go this year? Oh, well, we're washing our hands and we're doing all this. Well, I guess that works for the flu, but it didn't seem to be working for COVID. Anyways, I don't want to get into the details of that. You know, we've talked about it so much. You know me, where I come from. I'm big on you taking care of your immune system. You know that. I'm talking to my audience. I want you to protect yourself and the people around you as much as you can. Influence them. It's food. And here's what we know. Here's what we know for sure. People that are low in vitamin D don't do well with COVID. Okay? And what about masks? Well, how about mold on the mask, or touching the mask, or bacteria in the mask? And, you know, I know, you better change them. Guys, we were never meant to wear masks all day long, okay? Now, I know we live in a different world, and you know what I'm scared of? Here's just me, okay? Just me. This is never going to end. Dr. Fauci said something the other day that made me cringe. You know what he said? Because, you know what he said in March? Oh, we're going to get a vaccine. When we get a vaccine, it'll be all over, back to normal. You know what he said last week? No, even with the vaccine, we're never going back to normal. Oh, my word. Anyways. Okay? What about wipes? Well, I talked to you about that. I think, Nativity, you were asking. Amy was asking about touching the mask, but Nativity, well, look, wipes, again, these are chemicals. Make your own cleaner. I love the oil of oregano. There's nothing better in antifungal, antiparasitic, antiviral, antibacterial, antihistamine. Oil of oregano companies, you owe me money. As I talk about you all the time. Okay? Okay. Try and answer the rest of them. Asking about, Nancy's asking about beta blockers and blood thinners. Well, look, those are meds. Usually you'll get beta blockers, you'll get blood thinners. If someone's had a heart attack, you get, you come out of the hospital, you had a heart attack, here's what you're going to come out with. Beta blockers, you're going to come out with blood thinners, usually a diuretic. You're going to come out with a statin drug. It's just a cocktail of drugs that they give you. And I'm not telling you not to take drugs, but I want you to, the best thing you ever do, if you ever have a heart attack, the best thing you ever do, you better change your stinking diet. Otherwise, you're going to get another one. That's why we were talking about plaque. You lower all your markers of inflammation. Get your insulin down. Makes a huge difference. Huge difference. You might need meds to start off with, but the idea with these, if you can, is to do it with food and a few supplements. That's why I love high DHA oil. What it does to your blood vessels. You know me, I love Navitol. It elevates your nitric oxide. It helps to regenerate your blood vessels. I love B12 because it lowers your homocysteine, which is a marker of inflammation. Okay, good questions. Deanna, how can you stop snoring? Go sleep in the other room. No, but generally, and again, these are always exceptions, but most people, when they lower their carbs, well, we talked about this in sleep apnea. Like, what's sleep apnea? Oh, doc, it's a lack of oxygen. As soon as I put the machine up, it fixes it. I know, but why do you have a lack of oxygen? You got an obese tongue. In snoring, that's usually what it is too. And it helps a lot of people. It doesn't fix everybody, but it does help a lot of people. In sleep apnea, you want to know how many people have fixed it after the reset. It's incredible. Okay? Very good questions. Dry sinuses. Yeah, sinuses have a big effect too. Like dry or always, some people, they get nosebleeds. It's so dry. Try and elevate your humidity in your home. And some people, like, again, some people have very, very dry sinuses. Some people have, they're always, they got either, they've got postnasal drip, and they're always stuffed up and all this and that. Usually, both of them start in the gut. Candida. And Candida is the first cousin of mold. Gets into the side. It loves moisture. Okay? And then they have a lot of babies in moisture. Yeast grows in that because it's fungus-like a mold. It can get in your sinuses. And it can give you lots of trouble. So dry it. Some people, well, it's too dry, doc. Yeah, well, okay, then you can moisturize. Like some people like the neti potty or, to moisturize. I like it steam. I love oil of oregano, though. I find it very, very good for the sinus. Now, dilute it. Don't use straight in the sinuses. But you can put it in the air with the spray, whatever. Sniff it. Very good for sinuses and that. Okay, and okay, Susie, anesthetic. Long-term effects. For a lot of people, the anesthetic can really affect, your memory. It can affect your body in different ways. But what choice do you have? This is why I love, I always tell people, you're going to go under. One of the ways to decrease any side effect of that is to elevate your nitric oxide. That's why I love things like B12, and I love Navitol. I love DHA, which is really, really good to protect the body, and probiotics. Okay, so these are the things that I talk about. Al is talking about stress and memory. Yeah, it can affect your memory, because what does stress do? It elevates cortisol. What does cortisol do? It elevates inflammation. It can sure affect the blood vessels in your brain. It's meant to have a part-time job, stress, not to be long-term. So for sure, it can affect your blood vessels and affect... Shirley's asking about restless legs. Well, Shirley, listen, restless legs, I talked about it last week, but I'll repeat. You always find out what causes restless legs. One of the biggest causes of restless legs, what I call them the EBGBs of your legs. You go to sleep, but your legs won't. Okay? Microcirculation. Okay? The little wee capillaries. And I find that, again, and the other one could be anemia. It can be a sign of anemia. You don't even know you have anemia because your blood work is not necessarily showing it. But you're borderline anemic. That can affect your restless legs. And I've often put people on the blood boost, and then their restless legs were gone. I love Navitol for restless legs, for the microcirculation, because why? It opens up blood vessels. That's what nitric oxide does. Okay? Heather was asking about monocytes and leukocytes. Well, if they're high, you probably have a low-grade infection in there. You see leukocytes in the urine, oftentimes because you have a yeast infection. You don't see it and you might not feel it, but there's yeast in the urine. That'll elevate your leukocytes. There might be a bacteria in there. That'll elevate your leukocytes. What about low counts of leukocytes and monocytes? Well, again, you have to look at, look, you can rule out cancer, you got to rule out leukemias. You have to rule out a lot of stuff. But generally, when I find, with how many symptoms, that's a sign of borderline anemia. Because people think of anemia as just strictly red blood cells. But no, even the white blood cells. And if you have low levels of monocytes and leukocytes, a lot of times you got low levels of vitamin D. Okay. Brenda, bottom of the feet hurting and burning. That's a sign. You're generally, Brenda, okay? It's a sign that you're on your way to diabetes. Number one cause of burning feet and numbness. You could have a pinched nerve. You got to be able to take away all that. But generally, without that, that's your body saying, hello, you're becoming a diabetic. We had an email up about that yesterday. I think it was yesterday or the day before. Okay? Read that email. And Mary's asking about low lipase. What is lipase? It's an enzyme that your pancreas secretes. Okay? And your pancreas, if it's not working properly because of insulin, then you might have low levels of lipase. What's lipase? To break down fat. Your pancreas secretes enzymes. Lipase, amylase, protease. To break down protein, fats, carbohydrates. Your body has those. A lot of people, they get older, they don't have enough enzymes. Their pancreas isn't making enough. That's why I love digestive enzymes. Okay? So thanks, guys, so much today. Lots of good questions. We appreciate Question and Answer Friday. We're got a lot of good topics already for next week. And don't be shy. Ask your questions, okay? So we really appreciate that. Share this with your friends. We really appreciate the following that we have. We don't take that for granted. We love it. And we love you guys dearly, okay? We really appreciate it. You're the smartest guys on the block, health-wise, okay? So no nonsense here. I won't give you any nonsense. I promise you that, okay? Opinion, yes, but not nonsense. Okay, we love you guys. Talk to you soon.